From the beginning of time, people have sought immortality. It is reflected in society's fixation on youth, drugs, and even surgery to postpone the inevitable. But the reality is, 10 out of 10 people will die. The question is, should we be an active participant in planning our death, or should we leave it to chance?
I think people don't want to plan for the inevitable because it is probably one of the scariest moments in our life to think about. And also, but at the same time, it could be probably one of the most important decisions that we have to make in our life about how we get taken care of at the end of our life. And I think more and more people are wanting to do the preparation so they have control over how their final moments and days want to be spent.
As baby boomers age, the number of chronically and seriously ill people will grow exponentially. People with these conditions or diseases will have a need for palliative and hospice care.
Well, hospice care is caring for somebody at home that is at the end of their life. It's a team approach, and basically each case is looked at individually, and the team puts in the appropriate service for each person on an individual basis.
Hospice care focuses on caring, not curing. Hospice treats the whole person, body, mind, and spirit, as well as nurturing the family. A team of professionals, doctors, nurses, social workers, nurses' aides, chaplains, and volunteers, delivers the care, usually in the patient's home. Like midwives, they help patients stay pain-free, comfortable, and fully engaged in their lives.
How are you doing?
The biggest misconception is that hospice care means that there's no further hope. And that's the furthest thing from the truth, because it provides a sense of hope to the patient that all of their symptoms will be managed and they will be given excellent hands-on care. Their families will be taken care of, children will be taken care of, and they can also feel assured that everything is centered around that patient. And that's one aspect of hospice care that we're very, very proud of, is that it's patient-centered.
One of the problems with beginning hospice is that it is often not started soon enough. Sometimes the doctor, patient, or family member will resist trying hospice because he or she feels it sends a message of no hope.
I'd like the public to see hospice as a place where they can come in a time of stress, in a time when they have received some difficult news, that there are people here that can help them sort out the difficulty and the pain and the confusion that they're in, and travel with them on this journey as we help them see this person's life come to a satisfactory conclusion with their pain managed, family cared for, and people understand that we'll be here for the family after the person is gone.
I decided to provide hospice care for my mom and my sister because I'm a volunteer with East End Hospice, and I know how important it is to have help when I need it.
East End Hospice is a New York State certified hospice providing an individualized plan of care for terminally ill patients and their families and loved ones.
East End Hospice offers a full interdisciplinary team of professionals, volunteers, including skilled nurses, licensed practical nurses, social workers, home health aides, all the kinds of therapies you could ever want, respiratory therapy, occupational therapy, physical therapy, nutritional therapy. It's a complete package of an interdisciplinary team to be able to provide whatever the patient and family may need, including bereavement care for families and children and families once the patient has died.
Bereavement counseling at East End Hospice lasts for a year after the person dies. We're available to the whole family. It includes individual counseling as well as group therapy sessions and multiple contacts. Camp Good Grief is a very special children's program that was started in 1997 when we realized that our children were underserved. And we decided that a camp would be a good thing for the kids because it sort of fits the way that they grieve. Kids grieve in little bits. And so we thought if we could incorporate some therapy with some fun and make this into a program, that it would really be suitable for kids and be a lot of fun for them.
East End Hospice began 20 years ago as a volunteer grassroots effort in response to the lack of available care for people who wanted to come home to the East End of Long Island to die.
What we've grown into today is East End Hospice, and that is a full care, interdisciplinary team of nurses, home health aides, volunteers, pastoral care. And we help hundreds and hundreds and hundreds of patients and their families all across the East End of Long Island every year.
East End Hospice brings hope to the dying and their families and friends. By affirming life, hospice helps people conclude life with comfort and dignity, offering pain alleviation and symptom control in a familiar and caring environment.
I would recommend that anybody that has a need, that has a family member or friend with 6 months to live, that they contact East End Hospice, and the sooner the better, because they get familiar with the people in hospice and they're more comfortable with them than at the end.
Over the last 10 years, the patients are getting referred later and later in the course of their illness, which has led us to become almost a mobile crisis team. If you can imagine what the difference is between having 6 months to do your care and to get to know a family and to be secure and to have a family be secure with the care that you can provide, to now having between 7 and 20 days to do that kind of care. It has changed dramatically. We must get in there quickly and get our services secured and in place and gain the trust of the family very quickly. So that has had a dramatic impact on the care that we've given.
We actually just center it on the patient and manage their symptoms. So it's actually one of the more purer forms of medicine that we would like to practice. It also allows freeing up of a lot of resources, and I think we concentrate the care that we have for that patient and their family, and it actually is an extremely cost-effective way of providing good health care to patients at the end of their life.
Personally, my dad was on a East End Hospice program, so I got to see the process from the family side. And the support was incredible. It was what I've seen in the process for each and every of our patients. And my dad was provided with comfort and dignity at home, nursing visits, social work support. And I think the biggest gift for my family was the fact that we were able to get Dad home and have our family united and see him comfortable and peaceful at the end of his life.
The biggest future plan we have is to establish a hospice residence, a building where people can come and live out their life in peace and comfort, have their family come, have the dog come get up on the bed if they so want. But there are a great many people out here who have been the caregiver maybe for their spouse has gone before them, and there's nobody at home to care for them. And rather than be in an institution to live out their final days, such as a hospital or a nursing home, we would very much like to have a place of our own that we can open up to the public and have people come and stay. And we've been very fortunate. We've been given a beautiful piece of land on the water that we think will be an absolutely stunning place that people can come and live out their days.
For more information about East End Hospice, contact them today or visit eeh.org.